is being applied differently by different individuals and institutions. Diego Gulo returned to the UK from an affected area in Italy. Whilst he is under self-isolation, he says his son was told to return to school.
I'm fairly worried because if by any chance I am a carrier and if I infect my kids, or if by any chance the kids going out, for instance, my son going to school, doesn't infect another child or another teacher that might have another condition, that would cause serious trouble. I think at the moment there is no structural check being done on the population to ensure that there's definitely not an infection in each single individual.
The Spanish island of Tenerife is popular with UK holidaymakers, but the COVID-19 outbreak means hundreds of guests at this hotel have found themselves in lockdown and in limbo.
They've just recommended that we stay in our rooms, and if they see us out for too long, they tell us to go back to them. But that's all we really know. We haven't really been given instructions about what to do.
It's very, very vague. And whenever we try and get more information out of them, they very much just say, "We'll let you know," and obviously they never do. So
yeah, we have no.
Our news is coming from outside of the hotel, not from inside of it.
Despite the quarantine, this is now what the hotel buffet hall looks like. Back in the UK, this well-known face is now in self-isolation. Jon Snow must test his temperature twice daily, but it's the mental test of self-isolation that will be a challenge.
I'm more frightened by having to live with myself for 14 days on my own than I am of the virus, to be honest.
For now, as the cases grow, this man is under pressure to get the public health response right. With the global death toll rising, the consequences for getting it wrong could be fatal.
Well, joining me now is Dr. Richard Darwood, who's a travel health specialist at the Fleet Street Clinic, and Professor Asragani, an infectious disease epidemiologist at Imperial College London. Professor Asragani, first, how cautious do you think people need to be if you've got no symptoms but you're still self-isolating for whatever reason? Do you have to lock yourself in your room, or can you go out for a walk as long as you're not contacting people?
Sure. So this is a precautionary measure, really, to try to stop the further spread of anybody who might potentially be infected. So as you say, if you have no symptoms, you really have no cause for concern. But if you have travelled to one of the affected areas and could have been exposed, it's really a public health measure to try and contain the outbreak from spreading further.
So is it a kind of moral duty to try and prevent the spread to the very small minority who face fatal consequences? Or is this really overcautious, this self-isolating business?
So the principle behind it is to stop person-to-person spread to the extent that this virus might become commonplace in the community. So we're in a phase, as the Health Secretary said, of containment, trying to identify cases, especially people who've been coming in from areas with a higher rate of infection, and to stop person-to-person contact that might allow the virus to become established. I think there's a distinction. I think it's very easy for people to become obsessed with images of people wearing masks and hazmat suits and taking what seem to be fairly draconian precautions. This is a public health exercise. We don't want the virus to establish itself in the community. It's not because this is a dreadful, fearsome virus on the same scale as Ebola or SARS or some of the other more serious outbreaks.
So if, and it might be a when, this does become established here, there's no point wearing the masks and self-isolating, is that right?
There's very little scientific evidence to suggest that a mask will protect you as such. But certainly for those who have very strong symptoms and maybe a sort of cold symptoms, it may protect from onward transmission. But the evidence is quite patchy, and really, in that particular case, if you have symptoms, just like if you had flu, you are really better off staying at home.
But if, as you say, this is not like Ebola, we've got that clear, is it overcautious then to be closing schools in this country, to be cancelling sporting fixtures all over the world?
At the moment, there's no scientific justification for doing that. So I would certainly caution people against overreacting and putting in place measures that have no chance of being effective. There's not enough. So far we've got 13 cases in the UK. Shutting down sporting events in the UK will not make any difference as things stand, obviously the situation may evolve differently, and we rely on the science, we rely on the magnificent work that is being done from units like Professor Ghani's to actually model to model the effect of different interventions.
Yes, I mean, absolutely. We consider all these different impacts, and as the Health Secretary said today, if there is spread in the UK, then we may ultimately be moving to a phase of mitigation. And that's really where these, essentially what we call social isolation measures might come into place. That's not, of course, complete isolation, that's just reducing contact. And one of the clear ways you can do that is perhaps just stay a little bit further away from people.
Stop the handshakes.
Stop the handshakes and good hygiene.
So when you've had dozens of countries now affected, you've got person-to-person transmission in multiple countries, why do you think that a pandemic hasn't been declared, and would it be helpful if it was?
Well, the situation may change. At the moment, out of the 30 or so countries where the coronavirus has been found, the vast majority have got cases that number in single or double digits only. So there's not a lot of evidence that the virus is becoming established in those countries.
So it's increasing faster outside China.
Well, it is. We know that there's been travel from China. Some of the cases that have been recorded are people who've been evacuated from China, so they've not been let loose in the community. To me, what's much more worrying is where you hear about what's happening in Iran, for example, where instead of cases being identified, you've got deaths being identified before the cases, which suggests to me that the public health infrastructure there is really not up to it.
Would it be helpful, particularly in developing countries, for a pandemic to be declared by the WHO?
I think it's just a term, and it probably isn't going to make what we do different. So those countries are really at risk because of the weaker health systems, the poorer surveillance, and therefore that is of major concern. And really the focus should be on trying to contain and mitigate any impact of this as far as possible to protect both those in our own country, but also the wider world.
Professor Azra Ghani and Dr. Richard Darwood, thank you both for joining me. Matt.
Thanks, Catherine. In the United States, President Trump has laid into the media, accusing them of fueling fears about the coronavirus and insisting that his administration was doing a great job. He's due to hold a press conference later today. Let's go over to our Washington correspondent, Siobhan Kennedy. Siobhan, tell us more.
Well, Donald Trump, Matt, is under pressure from criticisms that his administration simply isn't doing enough to cope if there's a sudden increase in cases here in the US. To be fair, so far the numbers are pretty low. About 60 citizens in total have been affected. The majority of those were rescued from that cruise ship in Japan, and the rest are Americans who have flown back here from disease-infected, virus-infected areas. They are all either in quarantine or in hospital. Nobody has died. So far the numbers are low, but the panic does appear to be rising. We saw that in the stock market this week, which fell more than 1,000 points on 2 consecutive days. And then yesterday, the Centre for Disease Control really dialed up the rhetoric with a fresh warning. Let's hear from one of its officials now, hear what she had to say.
Now, it's not so much a question of if this will happen anymore, but rather more a question of exactly when this will happen and how many people in this country will become infected and how many of those will develop severe or more complicated disease.
Well, Donald Trump did not appreciate that. He's gone into defensive mode on Twitter, as you said earlier. He's blaming journalists for panicking the markets, and he's insisting that the US, he says, is doing a great job with respect to coronavirus. We know he's requested that $2.5 billion be set aside, though the Democrats say that's not nearly half enough. We'll hear the latest, Matt, as you said, in that press conference that the president himself is hosting in the White House in just over 3 hours' time.